From the Toronto Star, I'm Adrian Chung, and this matters. At this moment, in Ontario, what kinds of situations do you think have the most COVID outbreaks? Here's a clue. It's not from international travel, even though Premier Doug Ford keeps saying it is. It's not in long-term care homes either. After a devastating first and second wave, aggressive vaccinations have brought case counts down into the low teens. The setting with the most infections right now are workplaces. Nearly 24,000 people have contracted COVID through their workplaces in Ontario. 46 of them have died. Like so much of the pandemic, the people who cannot work from home, who have fewer choices, are most at risk. So, a year in, when the rules keep changing, why are there still so many COVID infections in workplaces? Are we missing the forest for the trees when we ignore the science behind how COVID is most easily spread? We're joined by Sara Mojtehedzadeh, Toronto Star's work and wealth reporter, on why so many workplaces remain dangerous for employees. Sara, it's great to talk to you. Thanks for joining us.
Thanks for having me.
In the past year, there has been a lot of talk about essential workplaces and essential work that certainly has been a big focus of so much of your excellent reporting. At this stage, what do we know about the risks of being an essential worker in Ontario during a pandemic?
Well, I think the first thing is that so many of us are essential workers and that the lockdown restrictions really didn't impact workers in two major sectors, manufacturing and warehousing, where we have seen so many outbreaks. And, something that makes these types of environments particularly high risk is the fact that often it's quite difficult to physically distance within these facilities. The work is often very fast-paced and physically demanding. And as I sort of dove into in my most recent piece, they're often quite poorly ventilated environments. And because of our, understanding now of the risks of sharing air in these kinds of environments, we know that that can be a hazard.
It is an employer's job to make sure that a workplace is safe for their employee, right? So what kinds of penalties have there been for businesses that aren't making those proper safety precautions?
Well, in the first part of the pandemic, I was sort of surprised to learn through requesting data from the Ministry of Labor that there had been very little in the way of fines and penalties. Only one ticket issued to an employer during the pandemic last year for violating the Occupational Health and Safety Act. But I was also noticing that in a lot of inspections in workplaces where I knew there had been significant outbreaks, I wasn't seeing much in terms of orders being issued or, violations identified of, not just the general obligation to keep workers safe, but also the specific requirements around COVID, the specific measures that employers are told to take in order to keep their workplaces safe. It just wasn't really showing up in the data. And so I kind of started to wonder, what are we asking of employers and is that sufficient to ensure that workers aren't going to find themselves in an outbreak situation? And that's how I really started getting into the aerosol transmission risk because what many scientific experts and occupational health and safety experts are saying now is that a plexiglass barrier in the context of aerosol transmission is not going to help. And so the things that inspectors are often going in and looking for, which is based on what the province is telling us about how this disease is transmitted, are not necessarily on their own going to prevent these major super spreader outbreaks that we're seeing in some workplaces.
Right. So part of it is enforcement, certainly from the province, but it's also the guidelines that they're giving to employers themselves. Is that fair to say?
Yeah, it's the script that, ministries and their enforcement officers are operating off. And actually, I spoke to some Ministry of Labor inspectors, not identifying them, about their experience enforcing. And they were frustrated as well because they feel they've been unable to enforce the precautions needed to keep workers safe, because the message from the top is that in most cases, this is not an airborne virus, that it's primarily droplet contact, and therefore the precautions that are required reflect that thinking. And so that is the 6 feet physical distancing. It's, surgical masks in most cases. It's things like deep cleaning and plexiglass barriers. And, in many instances that might be perfectly fine, but in a poorly ventilated food processor or factory, there's, again, many experts who are saying these measures are not enough, and we need to be looking at things like air quality, ventilation, N95 masks when you can't improve air quality, a much sort of more robust list of measures that inspectors should be looking for and recommending to employers and enforcing if employers are not complying.
Yeah, these experts that you talk to, do they think that there is a fundamental misunderstanding about how COVID actually spreads? What do they think?
Yeah, I spoke to one scientist at MIT who talked about this false dichotomy that really guided a lot of the response to COVID in the early days of the pandemic. This false dichotomy between large droplets and small droplets, and which one is the risk in terms of transmitting the virus. And her research has shown that is not an accurate way to look at airborne disease transmission. So she has this video of someone coughing, and it's not just, a few small particles drifting off into space and then large droplets, plummeting to the ground like a kind of cannonball. It's this cloud of matter.
It just kind of hangs in the air. Yeah.
Yeah, exactly. And it can travel up to 7 to 8 meters. So that is far beyond the 2 meters or 6 feet that we are told is appropriate in terms of keeping ourselves safe. And again, if you're outdoors or in a well-ventilated environment, 6 feet might be sufficient. But, her point is that if you're in, again, a poorly ventilated space, that material is hanging in the air and traveling pretty far distances, and therefore poses a risk to workers who are going into work every day and breathing that air in.
We'll be right back. That direct science, we can see how we now know, of course, that outdoor spaces are exponentially safer than being inside, because it allows for those aerosols, that spray that you're talking about, it allows it to disperse into the air, and obviously less dangerous for people.
Yeah. And, the sort of fresh air or outdoor air is really key. And, we've heard so many huge outbreaks in food processors and meat packers, for example. And one of the things about those environments is that it's really hard to increase outdoor air intake or fresh air intake into these environments because they're refrigerated. So you have to sort of limit the amount of fresh air that's coming in order to maintain those cold temperatures. So I think a lot of scientists and health and safety experts are pointing to the fact that we are seeing so many outbreaks, large kind of super spreader outbreaks in these environments that are poorly ventilated, and saying this really needs to be a greater area of focus in terms of health and safety and prevention.
So you also use the example of Conestoga Meats. This is an employer that has seen multiple outbreaks even when they've committed to other health protocols. But again, they don't talk as much about ventilation, right?
Yeah, so I went through hundreds of pages of documentation of 2 outbreaks that occurred at this meat packer, a significant meat processor in Ontario. And in all those hundreds of pages of documentation, it was really clear that this employer was really doing their best, I think, to abide by what the provincial guidelines are in terms of the required safety precautions, which again center very heavily on droplet precautions. So physical distancing where possible, plexiglass barriers, deep cleaning, surgical masks, etc. And in all those hundreds of pages of documentation, ventilation is mentioned just once. And, outbreaks are complex. There's usually overlapping reasons or risk factors why they happen. But what struck me about this particular outbreak was the lack of focus on air quality, when so many experts and scientists are saying this really needs to be a focal point of inspections, that you can be going in and, seeing everyone 100% surgical masked up, deep cleaning happening, et cetera. And alone, that may not be enough to prevent an outbreak if you're not asking the employer what they're doing about air quality risks. You're not asking, how old the ventilation system is and how much fresh air is coming into this facility. One engineer described this to me as, a significant blind spot in our approach to containing these super spreader outbreaks.
People listening to this might find this very frustrating because at this point, the data shows where the outbreaks are happening, especially in terms of workplace outbreaks. We understand the science of how infection and transmission happens. So would it be fair to say that there's a twin failure here, that there's a failure of enforcement and there's also perhaps a lack of guidance to businesses? Would that be fair to say?
Yeah, I think that there's been frustration even amongst the inspectors that I spoke to about their ability to appropriately enforce workplace safety measures, especially in the early days of the pandemic. Very few sort of tickets issued to sort of deter noncompliance. And, when you look at how other workplace hazards are dealt with outside of the pandemic, inspectors can go in and, shut that workplace down if it's not safe. And, yes, that is happening, especially in recent months. But I think many inspectors feel that it's been a little bit too little too late. One of the huge lessons that emerged from the SARS epidemic was this idea that we need to apply the precautionary principle, that when we don't fully understand a risk, workers must be afforded the maximum possible protection until we understand what exactly is putting them at risk. And from the very start of this pandemic, safety experts called for that approach. They urged the provincial government to consider the possibility of airborne transmission and offer workers the protection to reflect that. And the science has really proven that point. I think as time has gone on, there's been a clearer picture of the risks of shared air. But I think that there is mounting frustration in many corners now that the guidelines and requirements issued by the province do not adequately reflect that risk and that evolved understanding of the virus.
What do you think is the ultimate cost then of not getting this right, of not putting aerosol transmission at the forefront of how we talk about COVID and workplace safety at this stage of the pandemic, more than a year into it? What do you think the cost is?
Well, for this latest story, I spoke to at least a dozen experts, and I have to say that, some of them were in tears talking about this because they see the inaction on this front as costing lives, plain and simple. The failure to embrace the science, the sort of reactive approach to workplace health and safety, I think from their perspective could have made a huge difference in keeping workers safe. We know that at least 46 workers have died from workplace exposure to COVID-19. And for the most part, these are workers in low-wage, precarious jobs, often racialized workers. And again, I think for many experts, this has been a massive blind spot that has jeopardized people's lives.
Sara, thank you so much for your reporting on this and on so many things around labor throughout the pandemic.
Thanks for having me.
And that is Sara Mojtehedzadeh, Toronto Star's work and wealth reporter. You can find Sara's reporting on labor and workplaces at thestar.com. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Chung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.